Thank you very much for inviting me, and my lovely student Martin, who will be speaking shortly as well. It's just nice to be included. So yes, thanks so much. Can everybody see that? Just make sure that everybody sees the PowerPoint. Perfect, that's great, thank you. I might have a wee bit of issue getting to YouTube's, but we'll sort that out when we get there. Yes, so it's lovely to be here, and it's really strange to be in this virtual environment. As I say, there's no dogs here at the moment, so hopefully there's no distractions or disturbances. But I think everybody appreciates everybody's working from home. Well, we are anyway at the moment. But yeah, so thanks again for the invite. Okay, so it's a healthcare fair, so you want to know a wee bit about maybe my journey and who I am. I'm Anne Bain, and I'm the head of curriculum for health and social care at Dundee and Angus College. And so I'm going to actually talk a wee bit about health and social care, because it's obviously in my title. So that's, I think, quite an important aspect to maybe to tie the two together, which is really important considering there's a lot of changes going on in health and social care at this moment in time. So that's who I am at the moment, but then I suppose you maybe want to know, well, how did I get to where I am if you're talking about health and social care? Well, I suppose I kind of evolved, so you can see the picture there. I've evolved to where I am now. Am I a dinosaur? I'm not 100% sure what I am sometimes. But when I was at school, I was very confident that I wanted to go to art college. And I started to prepare my portfolio, and then I decided that when I was in A6 that I wasn't good enough to go to art college. I just lost a lot of confidence, and I thought, no, I'm not ready. This is not for me. And it was just a friend of mine had started to work in a hospital and said it was great, really enjoyed it, really enjoyed meeting people and caring for people. And I thought, oh, I never really thought about it before. I applied to get a job as a healthcare support worker, and I got one. And I worked in a hospital in Dundee. It was called Dundee Royal Infirmary at the time. It's no longer there, it's now flats. And I thoroughly enjoyed it. And it was just something that I just took to right away. The minute I walked into the ward, it was just something I thought, this is really for me. I really enjoyed connecting with people. I was very shy, I was very quiet, but it really opened my eyes to what I could do, and the satisfaction and job satisfaction that I got at the end of the day as well was so good. And I think what you need to think about, though, if you're thinking about a career in any kind of care, is, are you the right person for it? Do you have the right temperament? So you need to think about, do you have patience? Are you a good listener? I think that's really key, important things, that you need to listen to people and get their perspective. So you need to have quite an open mind as well. And you need to be really compassionate. And when I'm teaching students, I teach them a lot of things, but I can't really teach you to be compassionate. I think that really comes from inside you. So I think you really got to have a feel that you really want to help people. You really care genuinely about other people. And to have that empathy with people as well, to really truly understand what it's like sometimes to walk in their shoes. And that's not easy at all, because you'll meet people from all different aspects and walks of life. So I've worked with people in lots of different environments, and we'll come on and talk about that in a wee minute or two with my journey. So how did I get into nursing college? You're probably thinking, if I was going down the road of art. Well, I did have the wrong qualifications, to be sure. That was when I got into my final year at school. I did have the wrong qualifications. I had hires, I got 3 hires, but they weren't the right ones. And the right ones were really a science at the time. That's what they really wanted. And still is really important nowadays to get a science to get into to study nursing. So I continued working as my healthcare support worker at the age of 17. And I decided I came to college. And so I went to Dundee College. At that time, that was what it was called. And so in the 80s, a long time ago, I went and did a science qualification in an evening class. And that's how I got into nursing. So yes, I had art. I had strange things like Latin higher as well. I had English, but I needed a science. So I went off and did that at Dundee College. So they really supported me to get where I wanted to go. And then I started my journey. And that was a 3 years nursing programme to train to be a qualified nurse. And that was a great journey. In those days, working in the 80s, we went into wards that had babies were being born. So we went into midwifery wards. So I saw babies being born, and it was just so fascinating. At the age of 17, I worked in children's wards as well, which was very exciting. Very sad as well, though, you know, because some children didn't survive. Some children did survive, depending on what was going on with them. And then I worked with older people, which I love and continue to love all my nursing life. And we also worked in medical wards. We were working with people that were having heart problems, also surgical wards. So people were having big operations, big surgical operations. And I also worked in orthopedics. So people that had lots of trauma injuries, so motorbike collisions, traffic collisions, or road traffic collisions as well. So lots of different trauma. Accident emergency I worked in as well as a student. And we also worked in theatre, so we saw lots of operations, which was some were better than others, but it was very exciting to work in a theatre and the surgeons showing you. I'm quite small, I'm under 5 foot, and the surgeon would get a little stool and stand. I would be able to stand next to him and have a look in and see what he was doing inside the body, which was quite fascinating as well. So lots of interesting places in my journey of 3 years and lots of different environments. So when I qualified, so after 3 years, I became a qualified nurse, and you register with something that's called the Nursing Midwifery Council. And my very first job was working with young people who had brain injuries. So it might have been somebody that had maybe a road traffic collision, and young people, maybe 17, 18 as well. So I was not much older, 20 odd at that time. So that was quite interesting. They had physical problems, they had understanding problems, so they didn't always understand what was being said to them. So coordination, cognitive functioning was affected. But I also had people that had multiple sclerosis, so it affected their spine and their movements, and also other neurological conditions, so all related to the brain. So some really strange and unique and interesting topics or conditions as Friedreich's ataxia, which affects motor neuron, but also Huntington's chorea, which affects speech and language and also movement, and is hereditary and predominantly affects women. So really an interesting place to start my nursing career as a qualified nurse, but quite intense, quite challenging, because obviously these people are, some of them are very young, but very rewarding, always rewarding. At the end of the shift, although you're exhausted, it's tiring, it's such a rewarding place to work as well. And then I wanted to specialise, so I went into a medical department, and it was renal dialysis. And this is where people's kidneys don't work well, or they don't work at all. And you use a machine and you get all their blood out of their body, it all goes around this machine and it all goes back through their veins, and you're cleaning the blood. So what you and I would do normally to go to the bathroom and get all this toxins rid of it, they don't do that. So you have to do it for them. So you're really kind of keeping people alive by cleaning out their blood, and that was an amazing place to work as well. Really specialised. I learned a lot about renal disease. I learned a lot about machines and technology, but very fascinating. But the thing that kept driving me back to where I ended up laterally before I came into education was community and older people. I really, really enjoyed working with older people. I think there's so much they had to offer. They lived their life and so knowledgeable, full of exciting stories about what they'd done in the past, or they've been in, maybe been in the war, or the jobs they've had, and the families that they'd brought up. So I went in to do another degree, and I qualified in 1993, a long time ago again, and I became a district nurse, and I worked in the community, and I was looking after people in their own homes, which was such a delight and such a privilege to actually be working in somebody's own home. You are that visitor because you're entering their home. So again, something to consider, in your future careers. But again, you have to have compassion, you have to have care, you have to have patience, you have to have the ability to listen. So all these skills are really important. The qualities that you hold dear as well are really important for coming into nursing. And then, so really, I suppose 25 years working in the NHS or thereabouts. And I always loved to educate the students, and I started to come into education. And that's where, my journey has come to now and where I am. So what kind of things do you think you might see in the future, I suppose? And that's considering working in healthcare. So there's lots of places, and I've kind of mentioned a few of them already. So you can work in clinics, outpatients, You can work in a theatre environment. You can work in labs. You can undertake research. You can maybe work with physiotherapists who help people with mobility. You might even work with occupational therapists who help people make adaptations to their home to make sure that when they come home from surgery, operations, or conditions or changes in their life, events, then you can support them in their own home and actually help them as well. Radiographers are looking at inside the body, so you might be able to assist them and help them. There's children's wards, there's maternity, so babies being born. You can work in surgical units, medical units. As I did, you can work in community, people's own homes. You can work in a care home as well and offering support there. You can go offshore and work in the oil industry. You can go into other industries and be occupational health and support people that are in office administration. It can be any environment in industry. You can work in the prison service as well. And I visited Perth prison not that long ago with a student who worked there. Fantastic. It's like a whole hospital there. It's absolutely amazing. If you ever get the opportunity to have a visit, please go. You can work in schools, as you know yourselves. You can go on a cruise liner and you can travel the world as well. And really, registered nurses are accepted all over the world. In fact, they're really prized. People know that it's a really good education that they get in Scotland. And so people will accept all over the world. And New Zealand and Canada and America were crying out for midwives. So if you're ever interested in doing midwifery, there's definitely opportunities there for you. And over really to Martin, because Martin is a current access to student nursing student at Dundee and Angus College. And I just thought it'd be really nice if Martin came along and maybe gave his introduction about who he is and also maybe about his journey to where he's got to. Martin, if you're happy to start.
Yeah, hello, my name's Martin. I have my companion with me who Carol will see, who sees on a regular basis. So I'm currently at Dundee and Angus College studying the Access to Nursing course. So a little bit about me. I'm 28 and I'm actually a truck mechanic to trade. I left school when I was 16 with standard grades. I don't know if they're still called standard grades these days, but I'm not that old, but you know, never mind. And I served my time, did my apprenticeship, and then I moved on to work in the office as an administrator for a truck company. And I sort of moved my time between the garage and the office. So I have no experience when it comes to adult nursing, when it comes to care setting or anything like that. So for me, what would happen was through the pandemic, which I'm sure you're all aware of, I sort of started to question my career and the choices that I'd made through my time, and I started to feel that perhaps maybe where I wasn't the job for me. So my partner, she's actually a nurse, and essentially what would happen was I garnered a huge respect for her and what she did, and we decided that we sat down and we had a wee chat and decided that I would try to get into nursing. So because I didn't have any higher qualifications, as I said, I left in 4th year with standard grades. I had to go and achieve some higher grades. So the course at Arbroath College for me is the springboard that'll allow me to progress on to university. Dundee University is my hopes. I'm waiting to hear back on the tension, but hopefully. And so yeah, I'm trying to use this course as a springboard. So the course is excellent. There's a great mix of people in the class. I was under the foolish impression that I would be the oldest person there. I thought I was going to be surrounded by, you know, a lot younger people, and it turns out actually I'm one of the younger people in the class. So I think maybe a takeaway for the students is that you know, you're never too old to make a change and to try something new and to, you know, yeah, just make a change. So I'd like to go on and become an adult nurse, and I'd like to follow in my partner's footsteps, and I'd like to go to A&E. But unfortunately, I don't have any experience in the trade. So I'm sure once I get in and see different things, I'll want to work everywhere. So, but I have the aspirations to go on and do my master's degree. I'd like to become an ANP, so an advanced nurse practitioner. So they're the equivalent of or compared to being the step down from a doctor. So that's the aspirations, that's the hopes and dreams. And I think, like I say, that the access to nursing course is that opportunity that, you know, my parents certainly didn't have. They missed out on career changes, and it was something that I never got taught at school either, was that, you know, there were options. You know, what your first choice doesn't have to be your only choice. So, you know, yeah, I think that's about as much as I could say.
Thanks so much, John. That was really good. And, you know, I think it's John Martin, I should say, just you know, the fact that, you know, complete career change, isn't it? But you had to have that time and you know, think about it, because it's, you know, financial issues as well for you and your partner, and just thinking about, you know, life changes. But yeah, I think the pandemic has shown that, you know, it's such a rewarding and privileged job that, you know, the nursing is, and it's so desired now. I think that's really the nutshell of it. And I really hope that, I'm sure you will, man. I'm sure you'll get accepted to university this year. Just waiting for that final interview result. But yeah, it's so exciting, and you know, A&E is such an amazing place to work as well. Yeah, and an advanced nurse practitioner. And of course, men in nursing do really well, because there's, you know, it's a gender imbalance. There's too many women in nursing, so men predominantly end up with directors, or you'll be the chief exec one day, you know. But thank you so very much. That was really kind of you to give me your time and us the time to talk about that. Okay, so what jobs are available in social care? And you know, my title is health and social care, so it's really important. There's a social care crisis at the moment, so health is so important, but also social care is a really rewarding, wonderful place to work. So I couldn't really go without kind of talking a wee bit about that as well. I worked with lots of different people in my profession, social workers, social care officers, you know, were made up the multidisciplinary team. I couldn't do my job without these people. So, you know, praise given to them, and, you know, the benefit in community and care and lots of other areas. But there is a social crisis at the moment, and we're desperately needing people into social care. So really kind of blowing the trumpet for them today. But there's lots of places you can work in social care. You can work in residential care homes. You can work in a care home, looking after older people. Work in people's own homes, again, such a privileged place to work as well. People that work in social care can often work with people with mental health issues, and learning disability, and support people with learning disability as well. Nursing also, I mean, I've worked with people with mental health issues and learning disability also in my career, but predominantly if you go into social care, that might be a place that you might want to work. Also with criminal justice, so it's about, you know, offenders and trying to rehabilitate people into society, and you might work with young people to do that as well, or older people, it depends on the area. And obviously families and children, there's, you know, fantastic support workers, you know, supporting people out there in society. Or you might want to think about a career, you know, to go on and further it and do social work. So yes, you can go on and then further your career aspirations with social work degree, and again go into lots of other areas with social care. So really for me, I suppose it's kind of moving on to the next part of your journey is really how to get into college, I suppose, to study health or social care, if that's the way that you want to go. Well, we start really from level 4, and we go right up to HNC at level 7. And as Martin was saying, he's doing access to nursing, which is level 6. So level 4, that's one of our step into care. So that's a lovely programme. It really just, you know, we don't need any kind of formal entry requirements. Really just we're made on satisfactory personal statements. So be very, you know, clear about what you want, and, you know, you're desperately wanting to do health or social care, then, you know, we're keen on your personal statement. And we put you through a diagnostic test. Now, it's not a physical test. It's just, you know, just to screen, you know, are you able to be working at this level? So it might be a wee bit of English to sort of, you know, maybe go through a wee test. But again, it's online and it's not onerous for you. It shouldn't be too difficult. Level 5 is the next level up, so sort of like NAT 5s, and we're looking for people to have 3 NAT 4s to come onto that programme as well. So one usually is an academic subject and maybe core skills at level 4. And again, level 5 is a lovely introduction to health and social care. We've got lots of really interesting topics. We look at the kind of psychology and you know, the social influences of society on people and how people behave. We also look at different aspects of working together, communication. So it's a really nice introduction to health and social care. And then level 6, as Martin's doing, we look at, we do a social care programme, which really kind of takes you off to kind of HNC social services. And that one, we're looking at 4 national 5s or equivalent to come onto that programme. Or maybe you've already gone into level 5, so just complete your programme of study there with us and come on to level 6. And then Martin, he's doing the access to nursing. And you need to then complete the level 5 programme of care or have 4 national 5s to come onto that programme as well. And that's access to nursing. That can take you to either to university because you're doing 3 hires, or it can take you into our HNC health and social care programme as well, healthcare practice. And if you just came straight into HNC healthcare practice, you need 2 hires and an excellent reference, you know, as well. So just to be mindful of that, you know, we are expecting people to, you know, obviously colleges, further education is more of an adult environment. You're probably treated differently than at school. But again, it's just thinking about your progression and you know, where do you want to go and how do you want to get there. The other thing is that we undertake foundation apprenticeships as well. So you can do that, you know, obviously still while you're at school and work with the college as well. So we do it level S5. So we do subjects such as safeguarding people, communicating with people who are, you know, you're working with that person in a care relationship. And then the privilege of S6 is you can then go out and do a placement with employers. So it could be with the NHS, or it could be local authority. You could go to work with Dundee City Council, Angus Council, Perth Council, or you might have a private provider, and we've got lots of providers. In fact, I think last count there was 45 providers that we actually engage with for foundation apprenticeships and modern apprenticeships as well. So ultimately, all these programmes that can either lead you on to HNC programme as well, but we're looking for obviously a good, excellent reference and obviously complete programmes of study as well. We need you to complete things as well. So that's kind of another way that you could maybe come on to our programmes. And within our team, we've got lots of different variety of people in our team, adult nurses like myself. We have a learning disability nurse, which is fab to have somebody to support with lots of complex sort of physical and complex needs, which is fab. We've got a children's nurse. She just started with us, which is wonderful. She's just straight out of practice, so very fresh. We have social workers in our team, and we have an occupational therapist as well. So a nice multidisciplinary team mix of individuals, which is wonderful for us. And really, I suppose I'm maybe just slightly ahead of time, but just I guess maybe if there's any questions, and I'll maybe just stop sharing my screen.
Great, Carol, thank you. That was brilliant. Thank you so much. And thank you to Martin, and thank you to your dog. What's the dog called? No, that was brilliant. Thank you. Any questions, either hands up or shout out, or please, teachers, type into the chat box.
Yeah.
I've got a couple of quick questions, Carol, if you don't mind.
Yeah.
Obviously, you work with Dundee and Angus College, and that covers people living in Dundee and Angus. But obviously, this is a Tayside-wide healthcare festival. So can we assume that Perth College will, you know, reflect what you do as well?
Yeah, we work very closely together. One of my colleagues, Jackie, works at Perth College, and they do access to nursing. They do HNC programs. So they do HNC social services, HNC healthcare practice as well. I would imagine they do 4s and 5s, and I'm not 100% sure about foundation apprentices. So again, that's maybe something to explore. Perhaps teachers maybe need to connect with them and ask that. But the other levels, yeah, they do exactly the same kind of programs, because I work with Jackie quite closely on these programs.
And am I right in believing there are lots of jobs out there in the health and social care sector? You go, you do this training, there'll be a job for you.
Absolutely.
And in all of these, there's always career progression for you to develop your skills and your ability and your salary, obviously.
Absolutely. I mean, I think more so now than ever, I think it's really changed the landscape. You know, it was always so important, it's always so relevant. But I think now people are really recognising the value of working in health and social care. And I think the pandemic has shown also that you know, people have been able to get good jobs and be able to be secured in a job as well. And terms and conditions are excellent, never mind the local authority, but also in the NHS, excellent terms and conditions of service. You know, pensions, I mean, young people sitting here today will not be thinking about pensions, but trust me, that's really important for the future. So, you know, and even our providers, our private providers, you know, there's such more flexibility now. And yeah, you know, professional development, continual professional development and advancement. As Martin was saying, you know, to look to be that advanced practitioner, and he's thinking already, I could do my master's, I can advance and be that kind of junior doctor. Why not? Absolutely, definitely.
Brilliant.